Welcome back to Voices of Long-Term Care Insurance, the show where we bring you the sharpest minds and boldest ideas shaping the future of aging, wellness, and care. I'm your host, founder and CEO of the Helper Bees. And today's guest is someone who's been ahead of the curve for decades, Carol Barbour, President and CEO of Vigor Health. She helped pioneer the aging in place model before it was cool, leading Friends Life Care into national recognition. And now she's back in startup mode, scaling a whole new way to keep people thriving at home. From launching care models in the 80s to launching a tech-forward company in 2022, Carol has seen it all. So let's take a listen to my conversation with Carol, where she talks about innovation, resilience, and maybe even a little bit about her musical beginnings. Carol, welcome. I'm so happy that you're here with us. I've been looking forward to this conversation. We've had to pause a little bit with our podcast recordings, and you're one of our first new guests. You've been on my list for a long time. We actually served on a panel, I think a number of years ago, and I wasn't familiar with your work, but I find myself more engrossed in what you were saying than what I was supposed to be saying at the panel. And ever since, I've really been interested in your background. So thank you so much for spending a little bit of time with us here at the Voices of Long-Term Care Insurance.
It's a pleasure to be here. Thanks so much for having me.
Well, let's dive in. We always open with one particular question, and I'm sure we're going to go through quite a bit of your work at Vigor as well as Friends Life Care. But how did you get into long-term care insurance? How did you get your start?
Non-traditional, as you said, you mentioned Friends Life Care. I actually started in long-term care as a music therapist was my bachelor's degree, and I worked in a nursing home and then state hospitals, and realized pretty quickly that that was just not my calling. Went back to graduate school and got an MBA, and then also took my first job after that in the nursing home field, and found myself, even though whereas a music therapist was a urban Medicaid facility, and where I was an operations manager at a chain, they were suburban nursing homes that might have looked a lot nicer. There were still lots of people there who probably didn't need to be there. I pivoted and joined a team that had grant funding in the not-for-profit sector to develop a new business model that was an alternative to continuing care retirement communities, or CCRCs, for people who really preferred to remain in their own homes. We did a lot of research around this model, and as it turns out, it really has a lot of features that are very similar to long-term care insurance. So I ended up the CEO of that company, launched that business model, Friends Life Care, and grew that organization for many years, including a focus on keeping people healthy and independent and helping them stay in their own homes. It was really our success at achieving those goals in Friends Life Care that made us realize that what we had learned would really be useful in the long-term care insurance industry, which was really struggling with claims costs and struggling with so many facility-based care. So that was really how I kind of transitioned from the not-for-profit sector in an alternative to CCRCs over to long-term care insurance.
That's really interesting. CCRCs are top of mind for me because I think there's a little bit of innovation or a renaissance happening on CCRCs. I didn't realize how far back they went, starting in the 60s and starting here, what you were saying at Friends Life Care in the 80s. Can you dive a little bit deeper? How do you see the overlap with what you had built at Friends Life Care with long-term care insurance? I'm sure there's a financial component that might be similar, and I know there's similar goals with keeping at an appropriate level of acuity. But what are the other overlaps with long-term care insurance and CCRCs?
Let me just kind of give a little bit of a history of CCRCs. Back when we started the continuing care at home business model, or Friends Life Care, most of the CCRCs were what were considered type A, which means they were really all-inclusive contracts where a resident would go through an admissions criteria, they would move in, and then their fee would not change regardless of what level of care they needed. So if they moved to assisted living or they moved to nursing home, they were going to pay the same amount that they had always paid. So in that way, it was a way to plan for your future for your long-term care expenses, and you just stayed right on that campus. As the years have gone by, and I think this is part of that renaissance, a lot of different types of contracts have been introduced, some of which are just plain fee for service. You're moving to a community. If you need assisted living, you're going to pay a per diem rate. There's no insurance involved. And then there's all sorts of hybrid models that are kind of in between. In many ways, continuing care at home, like Friends Life Care, is very similar in that way. There is a component where there are different types of contracts, but a person who's a member, because they're staying in their own homes, they're not moving, goes through an underwriting process, but they also choose how much they want Friends Life Care, in this case, to pay toward their care over their lifetime. So that way, it's very much like long-term care insurance.
From the start, you've got a partnership with, you might call them a member or a resident at a CCRC. Tell me about care management programs. In long-term care insurance, we call it, as you know, wellness programs. But did you have imbued from the start from a CCRC at Friends Life Care this notion of care management, of a shared partnership of ensuring the right level of care at the right time? I assume because there's a financial gain, but could you dive into that at all?
Sure. From the very outset, the vision for continuing care at home was to have care coordination and care management. But also part of that, which I think is very different from long-term care insurance, is that we engage with those members from the very beginning. Even though they'd gone through underwriting and they were healthy and well, our goal was to have a relationship with them, so that when that change in health happened, we were there and we could immediately pivot to helping them get the care they needed, hopefully in their own homes. And in many cases, it was. As the years went on, we realized we actually had this amazing opportunity, not just to be kind of that safety net and provide care management when they had a change in health and needed home care or assisted living or nursing home. We could really potentially impact the trajectory of their aging. So we developed a number of protocols based on kind of evidence-based processes for helping people stay healthy and independent for longer. So we started introducing a number of assessments so that we could identify early on those risks for a change in health and recommend interventions so we could kind of change that trajectory. We were very thoughtful and mindful about capturing all that data. So we captured data on the scores people got in their assessments, how often they did them, how did their scores change. It was all longitudinal. If we recommended interventions, we kept data on, did they accept their intervention? Did they say they were going to implement it? Did they actually implement it? Did they tell us, forget it, I'm never going to do that? So that we were able to do a lot of analysis of that data after a number of years to be able to tell, are we making a difference? Are we really helping people stay independent for longer? And is there a difference between those people who implemented interventions and those people who said, yeah, we hear you, we're not going to do that? And there was. I mean, we were really able, the data really showed us that wellness programs work. If you identify those risks for change in a level of independence and recommend interventions and help people get those resources, they can stay independent for longer.
There's a bunch of threads I want to pull on there. It's one of the last phrases you just said, which is wellness initiatives work. I said that on stage at LTCI this past year in 2025. That said, we presented a bunch of data and said they work. There's a wide body of information, not only with long-term care insurance that has been third-party verified, but work like you have carried out as well as within Medicaid and other payer sources where it shows these care management initiatives work. We actually have to change the question of not does wellness work, it's how do we make them better? How do we have even more significant outcomes? So to that point, it sounds like you agree with that point. So I'm glad I've had somebody of your gravitas come and agree that wellness works. Your access to data, your access to engagement. I know that's the holy grail of a lot of carriers who might be listening to this podcast are like, man, I wish I had that. I wish I had that at the start. And I definitely wish I had that now. Do you have any lessons learned when you're engaging with these individuals? Like you're getting a feedback loop, you're getting whether they closed any sort of care gaps, not only just recommending them. Do you have any tidbits of things that worked in particularly well when you're engaging and encouraging behavioral change?
I think there are a couple of things. One is the training of the people who are doing the engagement. And I think one of the things that's key is meeting people where they are, and having people that know how to do that kind of motivational interviewing. Because there's some people that you're just going to know they're not going to be ready to do this intervention. So is there some smaller step you might encourage them to take? Is there a way to continue to encourage them and not just a yes, no, they're going to do it or they're not, but really assessing people's readiness and meeting them where they are and helping them move along that continuum. As you know, sometimes there are big behavioral changes that need to happen, but there are steps that you can take to get there.
You're right. And on those behavioral changes, there are large ones that are probably a little bit more difficult to get compliance with unless there's an acute event. If there's a chronic event, it's probably easier to do smaller steps. Were there any one, two, or three initiatives that you were particularly proud of where you saw massive efficacy? It could be like on balance and gait training. It could be on food and nutrition. It could be weight management, anything like that where you saw at Friends Life Care a pretty significant outcome that might have either surprised you or was exactly what you had expected and still big.
I think that what we have seen is that it isn't any one thing. When you're looking at the data from that, there might be one big thing for an individual, like you were able to assess that they were at risk for falling. They intervened, they did some PT, they did some balance training, and they never fell. And so that might have really made a difference with that individual. But I think we find it's really the comorbidities, but we've also been able to kind of look through and understand which of the interventions are most effective, as well as being able to understand, which are the triggers that are going to lead to the greatest risk. What are those things that we need to be looking for? And of course, falls is one of them.
Right. Nothing that really surprised you that stood out. I mean, I'm guessing cognitive issues were prevalent, especially as we started to see an increase in the mid 2000s of just being able to have a little bit more fidelity in the diagnoses. Yeah. Any other comorbidities? I think that's an important point where we sometimes in LTCI think about things as, one triggering event or a diagnosis. Even I think that might even be a misnomer from a perspective of going on claim. What I hear you saying is that you have to look at the whole package. So all the comorbidities, were there anything, was it like diabetes and a propensity to fall? I mean, what were some that you thought were particularly important to zoom in on with your work?
I think the falls one is always an easy one to talk about one day, so common with older adults. It's really looking at when you're not just saying what somebody's are they at risk for falling, and there's certainly even different kinds of risks. Is it because you have strength? Is it because you have balance issues? What medications are you taking? When are you taking those medications? Do you have a medication that makes you lightheaded when you stand up? Are you taking that in the morning? If you talk to your doctor about maybe taking that at night so that you're not at risk of having that trouble standing up during the day. What are the other diagnoses that you have? Osteoporosis or osteopenia? Do we need to be dealing with that? So I think it's those kinds of comorbidities that was really kind of looking at the whole person and not just perhaps the score they have on their fall risk assessment.
Well, let's fast forward a little bit because I know that was a big part of your life, but you're onto some interesting new work. I can't help but think with your work at Vigor that what you said initially with Friends Life Care were from the outset. From the outset, you encouraged not only care management, case management, you built a relationship and continue to foster that relationship throughout the decades. Now, if they're joining a continuing care campus, they might be sort of on the pre-claims using the LTCI vernacular. Tell me about Vigor. Did any of the work that you did at Friends Life Care saying, hey, I got to interact early with the individual, I got to be able to build a relationship, influence what Vigor is in your approach?
Absolutely. I think we learned a lot from Friends Life Care that Vigor is able to take and introduce kind of in the long-term care insurance setting, and recognizing that these are people, for the most part, at least with the legacy policies, who haven't engaged for all these years. So kind of just getting their attention alone is a challenge. We've been successful at getting 20% a little above to engage with us and do some assessments and talk to our care managers, which that's the important starting place. And then it's really kind of building that trust. And again, it goes back to the individuals, how you train them, how they can try to engage quickly. The other thing is that they need to be able to do that virtually. You can't be out meeting with people in person all the time. So being able to do that in a virtual environment, I think that was one of the outcomes that came out of the pandemic that was probably a positive, is that so many older adults really became much better equipped to and comfortable with interacting virtually with people.
And that's a good point. I'm guessing the CCRCs in the name, you're local. You can do a lot of face-to-face interactions. Plus, early days of Friends Life Care, there was no Zoom or high bandwidth capacity for communication. Now, Vigor, you're predominantly virtual, so you're sort of presumably nationwide. You're not restricted to a particular geo, so you probably had to use different tools. But where is that overlap? You mentioned training care managers or case managers or whoever you might be using. What are some of the other overlaps that you've seen with Friends Life Care, or things that are completely separate, like the virtual to in-person separation?
Friends Life Care certainly uses more virtual post-pandemic than they ever had before. But you're right, it's a more local, not-for-profit model where there is more face-to-face engagement than we anticipate having with Vigor, although we do have capabilities through partners to be able to reach people in person if that is needed. But the assessment tools, Vigor Health is really licensed to use all the assessment tools and protocols that have been developed within Friends Life Care, as well as the predictive model that we've developed to help by gathering some basic information, start identifying who's at the highest risk so that you can really zero in on the people that are most likely to be able to to need interventions to help them to stay independent and stay off claim for longer. So those tools are really very, very helpful that we've been able to develop from this 30 years of data that Friends Life Care has gathered.
You alluded to some numbers on the engagement side. I imagine that's probably a big challenge or difference, maybe might be more appropriate between Friends Life Care, where the members or the residents are buying into the CCRC. And again, you've got a captive audience. If you go to the Vigor, is there more of a challenge with engagement of earning that trust? Probably a third party in that situation. What are you learning from an engagement that you just didn't have those challenges at Friends Life Care?
You're right. I mean, I think just getting people's attention to engage at all when nobody's engaged with them for many years. But if we can get in front of people, then we've been successful at getting them to really share with us and to do some of the assessments so that we can, kind of run their information through the predictive model and understand what their risks are. I think where it's different, and we're still in the planning phase, is developing a new long-term care insurance product where this is embedded from the beginning. So like the continuing care at home model, that's an expectation when you buy the policies. There's going to be somebody there for you, and there's an expectation that you'll engage with them and develop that relationship over those years.
Yeah, I was gonna take us there. I know you've been in the planning phase for this product for a little while now, but it sounds really interesting. Others are baking in either provider networks or other wellness programs. How do you think you differentiate? I know you're still in the planning phase, but is it just more engagement from the outset, or is it like Friends Life Care where there's an expectation, not just the engagement, but of behavioral change, big or small? Again, I know you're in the planning phase, but anything you can talk about with your new product and how you're thinking about it?
Well, we're thinking about it especially with a younger, maybe slightly younger population, of much more digital and social engagement as part of building that trust and being a resource, potentially even being a resource if if you're in your 50s and your parents are in their 70s or 80s, like maybe you're a caregiver and you could use some support in that regard. So just trying to engage in ways that are going to be meaningful to people at the point where they are in their lives, and making sure that it's a reasonable expectation, really just making sure that they're brand awareness, if nothing else, and aware that you're a resource that they can turn to.
I've got to ask. I mean, you started your career, you mentioned in music therapy in long-term care facilities. I got my start post-science as well in long-term care as a provider. Have you dusted off any of that music therapy chops? Have you gone back into a CCRC and performed any of those therapies over the last few years, or is it something that you've been chained to your desk?
I still am a musician on the side. I play the flute, but I have to say I've not done any performances.
Yeah. We've found a lot of value in my
Mm.
long-term care facilities going back quite a bit, but just having music not only playing throughout the our communities, but putting iPods loaded up with favorite music and seeing just the tremendous effect it has on those with cognitive decline. Um,
There was one back when people had iPods. I don't know if it still exists, about music in memory, and they would meet with older adults who had cognitive disorders and find out what their memories were and what kind of generation they were from, and load the iPod. And there's really some incredible stories, including members of Friends Life Care living in their own homes, where the agitation was reduced and all these wonderful memories came out. And it was really incredibly impactful on a number of individuals, especially with cognitive disorders.
Yeah, I've seen it firsthand. I wouldn't have believed some of the stories unless I saw it myself. I'm talking about very advanced dementia, having music. Yes, you're right, reducing some of the aggression, agitation that can crop up. I've also seen the flip side where certain music will increase agitation. So you got to be a little bit careful, and it's unpredictable when it might crop up. But anyways, I took us back to your music therapy. Let's fast forward a little bit and let's talk just the general business. It sounds like you're CEO of a nonprofit. That was Friends Life Care. It sounds like tremendous amount of success there. That a large corpus of data that supports well before really this new cool initiative called Wellness and LTCI. Now fast forward to Vigor Health, where you're taking that model to other carriers or other providers in general, and then maybe even creating new products. What have you learned along that way? As if you've gone from nonprofit CEO to for-profit startup CEO, what are some lessons learned that you've taken through sort of your entire career that have served you well?
It's been interesting making this transition from a not-for-profit CEO to kind of leaving that role and being in a startup in long-term care insurance. And it seems to me that one of the things I've learned mainly through that process is it's really at the end of the day, it's all about relationships. It's, honesty, integrity, transparency, trying to find win-win solutions. And that's been the most telling for me. People on the for-profit side or the not-for-profit side, they're still people, and how they want to be treated and how they want to how you interact with them. So I think that's probably been one of my biggest lessons learned, is that they're not, somehow people on the for-profit side and the not-for-profit are not totally different at the end of the day.
Well, yeah, I've seen that too, and I've seen specifically our industry, which led to the genesis of this podcast, is a tremendous amount of collaboration, a tremendous amount of camaraderie, and trying to learn from each other that I have seen in the not-for-profit space. I'm curious about your take on this. I think for those who aren't involved in local or national nonprofits, they might think that there's not a lot of innovation. I've seen the opposite, especially in older adult care, at least locally here, and the nonprofits that I serve on. I've seen actually more innovation that exists in the not-for-profit space than in for-profit, where maybe it's because there's resource constraint and you're really dealing with challenging issues, and it makes you be creative and innovative. I'm curious if you've seen any of that in your work of, again, transitioning from not-for-profit into the for-profit, where you just said, hey, you know what, nonprofits, they do it better or different. Any parallels there?
I think the parallel is, and we both do work with long-term care insurance carriers, they're, as an industry, pretty risk averse. And so I think innovation is hard, and I get it. I understand there were so many issues with the legacy policies. There's a reluctance to try new things that, unless you have more assurance, are going to work. But there is a deal of innovation in the not-for-profit. And like you said, if there's not as much access to capital, you have to innovate. You have to figure it out. So you do it.
Yeah, scrappiness, I guess, is a common thread no matter what, whether in a nonprofit, a large company, or starting up. Um, So you've got this great career, you've got this great new company. Where do you think we're heading? You've been at LTCI, you see wellness starting to blossom and bloom and now mature, where you and I have said it, wellness works. Where do you think we should head?
I think there's still the work to be done, I think, to support the legacy policies. And I think the more success there can be within those blocks of business, hopefully, the more policyholders will get on board. And so there'll be higher engagement and indeed be able to help people lead better lives and stay more independent, at the same time reduce some claims costs. But I think the biggest opportunity, and I hope the long-term care insurance industry gets there, is really kind of rebranding themselves as not just kind of paying for long-term care at the end of life, but really being aging experts and wellness experts and partnering with their policyholders to help them live better lives and to share their goal of keeping people healthy, but still being there and helping them with the care management piece if they do have that change of health, because we can't keep everybody healthy till the very end. Let's face it.
Yeah, and that's right. And I've started to see that as a natural evolution of learning from other industries. You mentioned CCRCs, and then increasing there's the CCRCs without walls movement that's happening, where there should be a tight partnership with long-term care insurance carriers. Yeah, granted, there's not going to be as much scale, but there's a lot that we can learn from each other, and there's a lot that we can work together from a multiplier effect. But I want to say thank you, Carol. Thanks for spending a little bit of time with me. I cannot wait to continue to learn from you and all the experience that you've had running these care management and wellness programs to great success. And thank you for everything you've done for the LTCI industry and will continue to do with Vigor.
Thank you very much. And I've enjoyed this and certainly have learned from you and all you do in all the Medicare Advantage and other spaces that you are in too. So great conversation.
Thanks, Carol. If you enjoyed this conversation, give it a like, leave a comment with your biggest takeaway, and don't forget to subscribe to the channel for more industry insights. We've got more great conversations coming your way right here on Voices of Long-Term Care Insurance. Thanks for tuning in.